Welcome, class, to the Week 3 presentation for ME105 Medical Terminology. Our focus this week, 2 chapters to look at, Chapter 6 as well as Chapter 12. I know they don't go in order, so don't freak out. It will be okay. Chapter 6 focuses on the musculoskeletal system. Chapter 12 focuses on the integumentary system, just a fancy word for hair, skin, and nails. Let's dive right in and start with Chapter 6 first. What is on the inside of us does count. It's got a very important job. That's our skeletal system. So the skeletal system acts as a framework for the body. It supports and protects the internal organs. It has joints that work in conjunction, with muscles, ligaments, and tendons, making movement possible. Calcium is stored in the bones. Often we forget that. This is required for normal nerve and muscle function. Red bone marrow, which is located in the spongy bone, that's important to the formation of blood cells. So we should thank our skeletal system on a daily basis for all the fun things it does for us. Next, joints. Obviously, when we're talking about bones, joints are all part of it. So this joint or articulation attaches the thigh bone, which is our femur, to the 2 lower leg bones, our tibia and fibula. The cartilage covers the ends of the opposing bones. There's a fat pad and also bursa that provide cushion, and the muscles make it possible for the knee to bend. There's one term I want you to remember, arthroscopy. Arthroscopy, if we break that word down, scopy is going to be a visualization. Arthro is going to refer to joint, so it's a visualization of the interior of the joint. Arthroscopy is a surgical procedure. What's what in terms of our skeleton? Well, we can break it down into 2 areas, our axial skeleton versus our appendicular skeleton. So the axial portion protects the organs of the nervous, respiratory, and circulatory systems. The appendicular portion, that's what makes movement possible, protects the organs of digestion, excretion, and reproduction. It also houses our upper and lower extremities. You can see the breakdown of how many's in what and what's included on the slide. We are going to break it down into more technical terms. Get down to the nuts and bolts of what makes us up. Here you can see our skull is actually made up of 8 cranial bones and 14 facial bones. We do have 3 bones in our ear. Oftentimes we forget about those. The thoracic cavity, that's where our ribs and sternum are located. Our shoulder, mainly speaking, are clavicle and scapula. Sometimes they include the humerus as part of the shoulder, but the arm definitely includes the humerus, radia, and ulna. We have our wrist, hands, and fingers. Our wrist is our carpals. Our hand is made up of metacarpals, as well as our fingers are phalanges. The spinal column, it's 26 vertebrae in all, if you add up the cervical, thoracic, and lumbar, and it also includes the sacrum and coccyx. Our pelvis is made up of an ilion, ischium, and pubic bone. Our leg includes our femur, patella, tibia, as well as our fibula. Our foot is made up of our talus, calcaneus, tarsals, metatarsals, and phalanges. Notice that our fingers and toes have the same names, phalanges. Let's talk about fractures. As bad as it sounds, it's one of my favorite things. With my background in x-ray, I do love a good fracture. So, the classification and severity of the fracture, your book has an image that goes over that. But generally speaking, fractures are classified as complete, incomplete, or open. You can see open fractures are called compound fractures. That means that something is protruding through the skin. An incomplete fracture is where the bone is just partially broken. A complete fracture, that's where the bone is completely broken, but it does not penetrate the skin. That's known as complete but simple or closed. Closed reduction. This is a term I want you to be familiar with. Closed reduction. That's a form of treatment for a fracture where they pull the ends of the bones into alignment by manipulation, meaning by physical force, without surgery. So say someone, let's say they broke their humerus, since that's the bone we're looking at here on our slide, and it was just a little offline, nothing was protruding the skin. The orthopedic surgeon may come in and just simply pull the bone into alignment. That would be a closed reduction. Doesn't require surgery. Depending on the amount of pain, sometimes the patient may or may not be sedated for that. Bone marrow. Couple terms to know that goes along with it. Myelofibrosis. This is the replacement of bone marrow by fibrous tissue. Myelofibrosis. Osteomyelitis. This, if we break that word apart, we see itis as our suffix. We should think inflammation. This is inflammation of the bone, especially the bone marrow. Couple of terms to know. Tarsotosis has a silent P in it. It's kind of confusing when you look at the word. It's a prolapse of the ankle. That ptosis is going to mean a dropping or a prolapse always. Tarso refers to tarsals, which are found in our foot, making up the ankle. So tarsotosis is a prolapse of the ankle. Herniated disc, usually found in the lower back. It can be found anywhere in the spine, but more common in the lumbar region. This is a rupture of the intervertebral disc. It actually protrudes. It can protrude and press onto the spinal column. Some other terms to be aware of. Let's look at the one on the right since it kind of goes with the spine. Lumbar puncture. A lumbar puncture is a diagnostic procedure, usually to gather that sample of cerebrospinal fluid, and it can be tested to see if there's a disease process going on. So a lumbar puncture is where they make a needle puncture through the back in between the spinal processes to collect cerebrospinal fluid. Looking to the left, chondrosarcoma. This is, chondro is going to refer to cartilage. Sarcoma, usually that OMA, is going to tell us that there's a tumor or mass. So chondrosarcoma is a tumor of masses of cartilage. Here we see a hip, and we're looking specifically at the femur. And you can see the arrows on there, those weird areas on the x-ray. That's actually the mass of cartilage. Moving next to integumentary system. Important to remember that the skin is actually the largest body organ of the body. The skin receives more care and treatment than any other body system. It is part of our integumentary organ system. The system as a whole consists of the skin, hair, nails, sweat glands, and sebaceous glands. It has a lot of roles it plays. So the skin helps us with protection, helps with water resistance, helps with temperature regulation, vitamin D synthesis. Oftentimes we forget about that. As little as 15 to 30 minutes of sunlight a day allows the skin cells to initiate sufficient metabolism of vitamin D. And vitamin D is essential for bone growth and maintenance. And the skin is important for sensation. It houses the nerve endings that detect touch, pressure, heat, cold, pain, vibration, and tissue injury. The epidermis is a layer of the skin that I want you to be familiar with. This layer is avascular, meaning it contains no blood vessels. Some other functions of the skin: excretion, secretion, and social. Our skin does a lot with our social well-being. It can reflect emotions when we blush, or it can go pale if we're frightened, and it can wrinkle if we dislike something. There's one term that's related to hair that I want you to be familiar with. And here we can see a hair follicle and all of its parts and pieces and how it relates to a sebaceous gland. But the term I want you to remember is trichosis. Trichosis is an abnormal growth of hair in an unusual place. Burns are a serious condition or injury to our skin. The picture that we see here is actually a first-degree burn, and first-degree burns are also known as superficial burns. It's usually a result of prolonged exposure to the sun or short exposure to a very hot surface. Often, first-degree burns require no medical treatment and they usually leave no scarring. But some terms associated with this: vesicle. A vesicle is a blister smaller than 0.5 centimeters. Melanocytes. These are cells that are affected by excessive exposure to the sun, and they increase the risk of skin cancer. Some other good to know terminology regarding the skin. We have two terms on here. Wheal is the first one. That's an elevated and irregularly shaped lesion. Psoriasis. This is a common chronic skin disorder. It's characterized by circumscribed red patches that are covered by dry, silvery scales. Next, we have scleroderma. So scleroderma is a chronic hardening and thickening of the skin. All right, my friends, we have reached the point where it's your turn. Do you have any questions, concerns, or need further assistance? If you do, definitely reach out to me. You should all have my email address at this point. Don't hesitate to send me an email when need be. Even if it's an email just saying, hey, I'm keeping up, I'm doing well. I'd like to get those as well as the questions. So the more I hear from you, the better. Otherwise, I do worry. I like for you all to have a great experience, and I try to make it the best that I possibly can. As always, the information covered today is from your textbook. You do want to read both chapters in their entirety because it is important information. Thank you so much for listening today. Have a great week.